Hey, what's going on? It's Dr. Ganatra, and in this session, I'm going to go over with you the 3 Chairside psychology strategies to boost case acceptance. Now, here's the thing. These are going to be so effective, you'll be able to start using these with all of your patients. If you're thinking, oh God, I got to buy a new piece of equipment, I got to get a fancy camera, I have to do all this stuff that, I have to spend money to boost case acceptance, or I got to learn a new procedure. You don't have to do any of that. These 3 strategies are guaranteed to boost any areas of your case acceptance with any patients. So let's just jump right into it. The first of these 3 strategies, the first one, and I see people miss this all the time, they confuse this whole concept. The first thing is make your patients feel understood. Make them feel understood. We as clinicians, we always focus on, oh God, did they get the treatment plan? Did they understand what an implant is? Do they know how the root canal works? Do they understand all the appointments in the treatment? That's not where it's at. The whole idea behind this whole thing is to make them feel understood, to make them feel like, gosh, Dr. Ganatra, he gets me, or she understands me, or man, I feel so understood when I'm in the chair here. They get my concerns, my problems, my issues with the dentist, my past experiences. They get it. Before you do anything, before you want to have this feeling of like craving for that patient to understand you, ask yourself, have you made them feel understood? Do they feel like you, as their dentist, really understands their history, where they're coming from, their fears, some of the reasons why they haven't gotten the dental work done? Do they feel understood? And when you connect with them on that level, something magical happens. They open up their mind to trust you. They open up this kind of sense of like, oh, I get it. You know what? I can trust him. He seems really, on my side. You see, people are going to make a decision way more effectively, and they will make that decision quicker from their emotional brain over their logical brain. And when people feel understood, they open up their emotional brain. They're like, oh, I get this. Like, she understands me. Oh, I feel comfortable here. I feel safe here. Make your patients feel understood. Dive into the areas that they're having difficulty with. Ask the questions. Ponder the questions with them. Think through the process with them. Don't just jump to a solution because they have a problem. Ask and understand why they've kind of gone through what they've gone through, and then be that sympathetic ear for them and be like, oh, I totally get that. And maybe even share some of your kind of hesitations when you were growing up around treatment or another patient's hesitations. But most importantly, listen and make them feel understood. Give them the voice that they need to give you to feel safe with you. The second part, number 2, as you're doing this, realize that you gotta use way more imagery, pictures, videos, stories of transformation within the treatment plan. So you're going through the treatment plan and you're like, you know what? I'm trying to I gotta get the psychology right so that way they, accept the case. But the easiest way to tell a story is through pictures, right? They always say a picture is worth 1,000 words, right? But then a video is worth 1,000 emotions. So one step is use some pictures, and that'll help them kind of process what you're saying. If you're talking to them about implants, hey, this is typically what an implant is. These are the 3 parts to the procedure. We got the implant, we got the abutment, we got the crown. And show them the transformation of your patients. We did an implant on number 30 on Susie. Here's what happened. Here's where we started. Here's kind of us doing the procedure. Make sure it's a simple picture. Don't get too gory. Don't get too advanced. It's not the depth of information. It's the simplicity of information, right? So you're using imagery. You're showing the before. You're showing the during, what you did during the treatment. Very simple. And then the outcome or the after. Before, during, after. That's what you want to show them through your pictures. And then as you go through the pictures and as you're talking about things, you are talking about the transformation that the patient felt. gosh, he was struggling with digestion. He couldn't eat the foods that he really loved, especially he loved cashews and he couldn't eat them. But now he's eating all types of foods, cashews, peanuts, walnuts, pizza, whatever it is. And you're going through the whole transformation and how the patient feels. Because of that, you're storytelling. You're starting with the struggle. You're talking about what the patient did before they got the treatment done, how simple it was during, and then the outcome after, right? So before, during, after, show pictures. Even better, exemplify with video. Maybe you have video of the patient talking about their treatment. Maybe you have video of you talking about the treatment. Show the transformation. If you don't have this stuff, you could take 3-4 pictures, put them in a slide, like a slide, just PowerPoint, 3-4 slides, and you can narrate this stuff, and that's a video, right? So now you're showing that transformation. It's a huge difference. When patients can refine the image in their mind of what you're trying to tell them, they don't have to use their logical brain. They're like, oh, this feels good. This feels right. And we all like to take action on things when things just feel right, right? So that's number 2. Okay, now the third part. We all make this mistake. We go through the whole treatment plan. We're in there with the patient. We've made them feel understood. We're using the imagery. We're using the videos or maybe the pictures. And now it comes time to kind of make the next appointment. It comes time to make the decision. Always make it easy on the patient by giving them ultimate clarity on what the next step is without being open-ended. Do not be open-ended. What do I mean by open-ended? Well, let's get you in for your next appointment. Let's get you up front. We'll schedule that next appointment for you. Now, you may think, oh, God, that's not open-ended. We're telling them to schedule the next appointment. Well, it's open-ended to the patient because they don't know when the next appointment is. They got to check their calendar. They don't know if it's in the afternoon. They don't know if it's the morning. So what you want to do as a clinician, and I like to do this chairside. I sit there and be like, hey, how about next Tuesday at 10 a.m.? Can you get you in? We can finish this up a couple hours. I'll see you and we'll have you scheduled here. And it'll just take me an hour and a half to 2 hours and we'll get it done. I'm giving them a clear suggestion on what to do next. Just that alone will make them say either, yes, Dr. Ganatra, that sounds great, or you know what, can we do the afternoon? So now you have a clear suggestion. It's not open-ended. Anytime you leave something open-ended, it creates more confusion, right? More confusion, which is a lack of clarity, which is a lack of commitment. So open-endedness is the worst thing when it comes to commitment. So if they say, hey, I can't do the morning, I can't do the afternoon, let me check my schedule. What do? Well, yeah, absolutely. Get back to me with your schedule. Let me give you a few appointment times that could possibly work. How about Wednesday afternoon or Thursday morning? Check on those. Check in with your schedule and we'll coordinate it. You always want to give them a clear place for them to land. And if you're collecting in full that day, here's what we can do. Let's get your paperwork all done. Let's get it all set so that way when you come in the next time, you don't have to worry about signing paperwork, making payments, none of that stuff. It's all taken care of for you. Let's just do that today. Make the suggestion. You're not leaving it open-ended. You're giving them a clear plan on what to do next. I like to do this chairside, where I'm suggesting a date, where I'm suggesting what to do next. I'm not saying, hey, let's just get you in. Generalities decrease case acceptance. Specificities, where you being specific on exactly what needs to be done, that boosts conversions. Because when people get specific data, specific instructions, guess what? They got to think less. And anytime you got to think less, you're more likely to make that decision. All right? So 3 simple ways, 3 psychological strategies, I should say, to boost case acceptance, right? Make them feel understood, more so than them just understanding you. Make them feel understood. The second, use imagery. Refine the image in the patient's mind. Use pictures and videos and transformation stories, storytell. And the third thing is give them a clear outcome of what is going to happen next. Be specific, don't be general, because when people have a framework or what to do next, they can go on autopilot and say, yeah, sure, let's do this, versus them having to think about it, come back to you and say, this is what I can do. And that kind of delays things. So I hope these 3 psychological tactics and strategies helped. Try using them this week in your office and let me know what you think in the comments. I love making these sessions, these videos here for you. As always, more to come, and live inspired.